healthcare delivery industry challenge of our times: the quality, the cost, and accessibility. The solution approaches. One healthcare CEO suggested, let the healthcare operate like airlines, or let healthcare be decided by the political powers of the day, which service should be included or not included. Focus should be human empathy to eradicate suffering. Regardless of the solution approach, the challenge is in front of us, and it is manageable. Healthcare industry has a unique set of strengths, starting from discovery of penicillin to the current day science, where we have ability to cure almost any disease known to the mankind. And it is staffed by the most dedicated professionals who are always prepared to put themselves at harm's way to help others. So given these strengths, and given these challenges, we can overcome them. So what is the challenge? A leading spinal cord surgeon, Dr. Alice Vaccaro, who also consulted Sidney Crosby when he was going through soft tissue injury, he suggested that in his OR, he has space-age technology. He has ability to see what wasn't possible only a few years ago. The point Dr. Vaccaro was trying to make is that in his OR, he has space-age technology. When the patient leaves his OR, he has very little visibility into quality of care that patient is receiving. That is the challenge of the day. Industry response, Health IT. We have an app for that. Unfortunately, after billions of dollars investment in Health IT, I'm not sure if we are anywhere closer to the end game. Asking Dr. Vaccaro, does he have a better visibility into quality of care his patients are receiving after they leave his OR? The answer is probably no. So where to from here? I wanted to share a story where a bunch of doctors and system engineers teamed up together a few years ago and decided to improve two things: interprofessional communication and handoff. Since the first part worked well, we added additional capabilities to the system to bring evidence-based practice to the bedside. The results? We didn't have to train anybody to use the system. People used the system even when their organization didn't demand them, partially because they were useful and they were easy to use. As a system engineer, this was probably the most gratifying experience. When you build a technology that is useful and easy to use, people use it, not because somebody's making them do it, because it works for them. Over the years, we built a suite of tools, and we're making them available to any hospital who's interested in using them. Our job is far from over. Healthcare industry is a very interesting place. You need a lot of proof to get people to take you seriously. We are currently deploying our solutions at various institutions to convert academic research into translational research. All that means, what works in lab, let's test it out on the shop floor, see how it performs. If improving healthcare delivery is your passion, we can always use a hand. My name is Jason Hipal, and I work for iCare Quality, and we are committed to improving delivery of healthcare industry, not only Canada and the United States, but globally. Thank you very much for your time.